a letter, and I'm going to break down the medical parts of this letter for you, okay? This was a letter that was presented by one of the healthcare practitioners that was involved just a little bit in Hardel's case, but enough that she was deeply disturbed by what she saw. And when she tried to get him sent to the hospital, the jail administrator overruled her and said, no, he can't go. And that's another issue. Since when do we allow non-professionals, non-medical professionals to overrule the judgment of a medical professional? That could happen in a jail or prison is outlandish to me. So I'm going to read this to you. I have been an employee with the company MEnD Healthcare for approximately 3 weeks, beginning in mid-August. Technically, I am still in training. On August 31st, I should have been with my boss and MEnD owner, physician Dr. Todd Leonard, as I was in training, but Dr. Leonard told me he could not make it till Beltrami that morning, and I would have to go by myself. When I arrived at the Beltrami County Jail, the med tech and the RN advised me there was an inmate who was faking being paralyzed and that I would have to take a look at him. They told me he was even faking being incontinent, and that was why he was wearing adult diapers. I reviewed his chart and noticed that he was consistently hypertensive, which means high blood pressure, in the 150s and 160s over 100s, and that's very high. That's the kind of thing where we really, especially if that lower number is above 100, we want to see somebody in the hospital, okay? And it was tachycardic. And tachycardiac means that the rapid heart rate, very rapid heart rate. An EKG had been done on August 30th. The EKG read abnormal and inferior infarct. And an inferior infarct means tissue death of the lower part of the heart, typically from a heart attack. So, you know, it's not something to just go, oh, that's a little something to wave by, okay? That he had probably had, along the way, a heart attack. I personally don't have experience reading ECGs, so I asked the RN if Dr. Leonard had seen the ECG. She told me that she read the report to Dr. Leonard over the phone, and he told her that inferior infarct is normal and the ECG is of no concern. And I have to tell you that as a longtime nurse who has taught advanced cardiac life support and pediatric advanced life support, there is no way in hell that that's normal. That is simply not true. You see something like that on anyone, and if you've got any sense at all, you are taking them to the hospital. You simply cannot ignore a symptom like that. What it means is literally part of his heart, the bottom part of his heart has died. So this is so outlandish. When I read this, I just couldn't believe it. I asked her if the patient was on any medication for hypertension. She told me he was on lisinopril on the outside. So that's an anti-high blood pressure drug. I asked her why he was not on anything currently, and she told me he wasn't on any medication because he was saying that he was having trouble swallowing. That's an advanced symptom, again, of Guillain-Barré syndrome. The RN told me that on August 30th, Dr. Leonard advised the RN to send Hardel to the local emergency room, but the jail administrator vetoed it, saying after she had listened to Hardel's phone conversations with his family, she believed he was a flight risk. This is a guy who couldn't move his legs now, okay? Keep that in mind. I was brought to Hardel's cell by the RN, followed by a correctional staff worker. On the way, we stopped at control where the other officers were speaking very negatively about Hardel, saying he was faking his situation. When I got to Hardel's cell, I was overwhelmed by the stench. It smelled heavily of urine and sweat. Hardel was laying on his back on the floor. He was on a mat full of urine and drenched in sweat. He was wearing a diaper that was soaked with urine, the urine then soaking the mattress pad underneath him. When I looked at Hardel, I immediately noticed that the right side of his mouth was drooping. That's a neurologic symptom, again, consistent with Guillain-Barré. That's a situation where when you see a person's mouth drooping, you start to think of strokes, you start to think of cranial nerve injuries, things like that. Those are very, very frightening symptoms. These are not symptoms to be ignored. When he spoke with me, his words were slightly slurred. He looked at me and he asked me to please believe him that something was wrong. He told me no one was believing him. He told me he felt numb from his waist down. Again, another symptom of Guillain-Barré. He said he had pain in his back. Yet another symptom of Guillain-Barré. He asked if he could have his diaper changed and have clean clothes. He said the officers were refusing to change his diaper and clothes or help him clean up. I asked him what was the last time he ate or drank something. He told me he could not eat because something was wrong with his swallowing. Again, another symptom of more advanced symptom of Guillain-Barré. He said his throat felt weird and that it was difficult to swallow. He said the day before I saw him, he was able to drink 2 small containers of apple juice with assistance from an RN. During that time, though, on the video, you can see that he's complaining about choking. He's having difficulty getting that material down the apple juice down his throat. The RN was getting Hardel's vital signs with the machine as I was speaking with him. He was tachycardic with a heart rate of 132. We consider 90 to be tachycardic, so he was very tachycardic. His blood pressure was hypertensive. I cannot remember the exact numbers. His O2 saturation was 83 or 84. O2 means oxygen, and that's a measure of how much oxygen is in your blood. We treat people at 94%. He was at 83 or 84%, which means he was hardly getting any oxygen to his brain at all. And that is really a serious sign. It shows his respiratory system was shutting down at that point. I said that he needed to go to the emergency room immediately, and that I was concerned that he had had a stroke. I was told the only way he is going to the hospital was in a deputy vehicle with armed officers. While I waited for the correctional staff, I directed that Hardel be changed into clean clothes and that his diaper be changed. The RN started to put on a new diaper and new clothes. The correctional staff would not help change the inmate. I was assessing him and noticed that his body was cold, but he was extremely diaphoretic. So diaphoresis means sweat. He was sweating crazy, but his body was cold. So clearly some things were going wrong. And when you see those kind of heart rates, respiratory rates, blood pressure, diaphoresis, those things indicate what we call a autonomic nervous system disorder. And that means basically that his nervous system was shutting down at that point. And basically, he had no Babinski reflex, meaning his nerves in his feet weren't working. His grasp reflex was weak, especially on the right side. I started to help the RN put new clothes on, which was difficult as he was like moving dead weight. While rolling him slightly, Hardel was crying out in pain. The officers at some point brought a wheelchair for Hardel. The RN was upset the officers would not help lift him into the wheelchair, so she went down to control and asked officers to help lift him into the chair. The wheelchair did not have rest for his legs. When Hardel was getting changed into clean clothes, I remember him saying to please don't let the officers touch him. He was also crying. He had tears running from his eyes when he pleaded with me to get him help. He told me that he was scared. He stated that he wanted to speak with his family. That night, I had trouble sleeping as I thought about the condition in which I found Hardel. I contemplated as how and to whom I should speak. I was just grateful that he got to a hospital. That was Friday evening, August 31st, and a long holiday weekend followed. I did not find out that Hardel had passed away until yesterday, September 4th. I was training at another jail with Dr. Leonard. He was sitting across from me as we were reviewing charts. He received a phone call and I heard him tell whoever he was speaking with that there had been a death in the Beltrami County Jail. My heart sunk because I knew it was probably Hardel. When Dr. Leonard got off the phone, he told me he was talking with his attorney. He told me that he was sorry that he'd forgotten to tell me Hardel had died on Sunday night. He told me that Hardel had been medically cleared from the emergency room. He told me that they did a thorough examination and CT scan, which found nothing. I told Dr. Leonard that I disagreed, that there was nothing wrong. I told him that the vital signs and the ECGs don't lie, which are both of which are consistently abnormal with Hardel. I also told him that I was very confident that when it comes to my clinical judgment and that something was very wrong with Hardel, he was very sick. Dr. Leonard told me, quote, not to jump to conclusions, and he said that jumping to conclusions could jeopardize his company. Wow. So that's what he had to talk about. He also, at a different point, told her to tell people that if they asked, that he had stuck a sock down his throat. So that's the quality of medical care that people get at MEnD Medical. Hardel is not by any means the only person that has been harmed by MEnD Medical, but and he's not even the only person that's died from MEnD Medical. In my personal opinion, I believe that Dr. Leonard should have his license pulled, and I believe that he should go to prison for criminal medical negligence.
Yes.
That is my belief.
Yes. Yes.
Don't get it.
Thank you.
If Hardel don't get it,
Shut it down.
if Hardel don't get it,
Shut it.
telling me this. She says, well, you're just finding this out now? I said, yeah, we got this in an investigation from the DOC. She said, oh my God, I wrote those letters back 3 days after Hardel died. In fact, I called Ramsey County Medical Examiner's office 3 days after Hardel's death and told them what happened. And then I wrote it up because Is it not cardinal rule that nurses are supposed to document everything, Michelle?
Absolutely.
So she did an excellent job. She not only wrote the Ramsey County Medical Examiner's Office this letter, she wrote the DOC this letter, which is where it was found, but she also, in turn, wrote the nurses board, the same letter, and she wrote the medical board of physicians, the same letter. But yet, only 2 of them have surfaced. Only 2 of these letters have surfaced. And so we're waiting to see where the other 2 are going to show up.